Hi, my name is Dr. James Broussard,
I'm Dr. Walter Ruff.
and we're clinical psychologists with LeFleur Behavioral Health. First off, I'd just like to thank you for your interest in our practice. We're going to use this opportunity to share with you a little bit about what we do and hopefully how we might be of service to you.
Across all the services we provide, we really focus on empiricism, or basically using treatments and assessment techniques that have been proven to be effective. Not just things that we think might work, we think might help people, we think might give us real answers. We're using intervention and assessment techniques which have been validated repeatedly with scientific research. And again, I think this is one of the most important focuses of our practice, is that using the best tools allows us to offer people the potential for the best results. We want to help you in a significant way, and I know Dr. Broussard as well, believe that the most effective way to help people is to use the tools that have been shown to work. So throughout everything we do, we rely heavily on an empirical approach or a science-based approach.
So, in light of the current pandemic, individuals are wary about meeting in person to receive services. Fortunately, both myself and Dr. Ruff are specially trained to deliver services over the internet through video conferencing, similar to Zoom or Skype. Also, we offer our clients the option of telephone-based therapy. Now, if you do have a preference or a need, for instance, like with assessment, to meet in person, we can provide that still, but just taking appropriate precautions. So this would mean wearing masks, having social distancing, and limiting the amount of handling of different materials that haven't been first sanitized. But even beyond just the pandemic and these procedures to protect ourselves, we also use telehealth and other sorts of ways of reaching people, basically to increase access. So if you're in a rural area, or it's just difficult for you to travel to a fixed location, we have the technology and the procedures to meet you where you're at, to get you that help that you need, despite any barriers that you might be facing.
Yeah, so just to piggyback off what Dr. Broussard said, this telehealth option is something that allows us to be safe and adhere to appropriate social distancing, and it also makes treatment much more convenient. You can bridge a geographical distance in seconds rather than having to drive 30 minutes or an hour to an appointment, sit in a waiting room with other people. This is the most convenient, confidential way to receive psychological services, I believe. So at LeFleur Behavioral Health, we address our clients' mental health needs with three primary services. The first service would be individual psychotherapy, then we have group psychotherapy, and then we also offer psychological testing or assessment. With individual psychotherapy, you'd be meeting one-on-one with your provider in a confidential setting to discuss anything going on in your life which may be causing you distress or any other type of hardship. Some common issues that we cover with individual psychotherapy are anxiety, depression, general stress, trauma, recent loss of a loved one or a major change in your life, to more specific things like OCD, mood disorders, sexual dysfunction, addiction issues, many other issues as well.
LeFleur Behavioral Health offers clients the option of outpatient group relapse prevention. These groups can occur weekly, bi-weekly, and in some cases individuals could even participate on a monthly basis. And the groups are really designed for individuals that are struggling with a range of different addictive disorders. This could be alcohol use, substance use, or behavioral addictions like gambling or problem internet gaming or just gaming. So our approach first helps individuals to self-select a goal. Normally this is either reduction of the behavior or sometimes to stop the behavior altogether. Now, the group aspect allows individuals to get feedback and to feel supported by individuals that are having similar sorts of problems. A lot of times, even family and friends that really want to help, they just don't quite understand what it's like to have a problem with a substance or with alcohol. But meeting with people on a weekly or up to a monthly basis that are having similar sorts of problems is often very useful. The final helpful component is that our groups are confidential, and you will meet under the guidance of a licensed clinical psychologist with a wealth of experience and knowledge working with people in recovery. It sort of keeps the groups on track, and also to get the highest level of quality care that can be provided to, again, assist individuals in maintaining and achieving their goals.
The third service that we provide is psychological testing or assessment. This is an area that clinical psychologists are uniquely trained and suited to carry out. Essentially, the idea with assessment is if there's a question about psychological functioning, our job is to find the answer to what's going on. This can cover a wide variety of questions. Some of the most common questions that we look into, though, are related to academic functioning. But this would include testing for disorders such as ADHD or attention deficit hyperactivity disorder, specific learning disabilities, so problems with reading, mathematics, writing, individual differences in intellectual functioning, so testing for giftedness or intellectual disability. We also test for autism spectrum disorder, and we test for differences in processing speed, which may affect someone's ability to perform on standardized tests, such as the SAT or ACT. From the information that we gather through these assessments, we're able to make recommendations for any variety of treatment options or accommodations in the classroom or in testing environments. So extra time, use of special materials, it all just kind of depends on what's needed. And again, the idea here is to level the playing field, not to give someone an unfair advantage. So in addition to academic sorts of testing, we also are uniquely qualified and trained to do a variety of medically focused assessments. Common areas that we look into are pre-surgery assessment for bariatric procedures, so weight loss surgery. So many times an insurance company will require a psychological evaluation before greenlighting those types of procedures. We also do another common assessment is for chronic pain issues, so for spinal cord stimulator implantation, for example. Similar kind of issue there. A lot of times doctors and insurance companies want a psychological evaluation before proceeding with those types of procedures. And we are experienced and trained in how to administer those tests and interpret the results and make recommendations about suitability for procedures. So academic assessment, medical assessment, and then there's a wide variety of more specialized assessment needs that can be especially tailored to unique questions or unique circumstances. Personality assessment, differential diagnosis, pretty much any question you have about psychological functioning, we can work with you to hopefully find a way to get some answers about those questions.
If you would like to know a bit more, or you're trying to make a decision if our services are right for you, I'm just going to encourage you to give us a call. We're happy to consult with you. There's no commitment necessary, and we can answer your questions. Really, our main goal is to help individuals, their families, and really to make an impact in the community that we serve. So give us a call, and we're looking forward to speaking with you. Thanks so much for watching.